Okay, this is Malachi Bishop. This is Rehab Counseling 650, Rehab Counseling Theories and Techniques, Semester 1, and today we'll be talking about person-centered rehabilitation counseling. Person-centered theory is the theory under discussion, and we'll be talking about Carl Rogers. If you remember, those of you who've been paying close attention, when we talked about psychoanalysis, I mentioned that only about 1 to 2% of counselors identify themselves as psychoanalysts, and not a lot of psychoanalytic techniques really being used in rehabilitation counseling. Same is true of Adlerian theory, where about the same percentage, a little bit higher, of counselors and rehabilitation counselors identify themselves primarily as Adlerians. But quite a few, not the majority, but quite a few counselors do identify themselves as person-centered counselors primarily. This is a theory that is quite popular among counselors, and even those of you who will eventually say that you are eclectic. I would wager a lot of you are going to say, I'm eclectic, but I work from a person-centered perspective. And that's something I hear a lot. So we'll be talking about Carl Rogers' person-centered theory, and a little bit about Carl Rogers himself. He was this is our first American-born theorist. Carl Rogers was born in Illinois in 1902, and Carl Rogers was the fourth of 6 children, and he spent most of his childhood on a farm. His family were farming people, Christian fundamentalist parents, valued hard work and responsibility, and Rogers described his family growing up as close and devoted, but not given to emotional displays or displays of affection. So Midwestern Christian family. Carl Rogers himself was an avid student, excellent student, read incessantly, read all the time. He was planning to, when he entered the University of Wisconsin-Madison, he was majoring initially in agriculture, but he switched to history as this was more in line with his plans to eventually become a minister. He graduated from university and married his childhood sweetheart in 1924. He did actually enter the ministry, studying theology across the street from Columbia University. Became disenchanted while he was studying to become a minister. And his problem was with the concept of original sin and a few other ideas, which, if you think about his theory, and I know you've read the chapter, if you think about what he says about people, then you can understand why he would have trouble with the idea of original sin as he saw it. And I'll let you think about that. But he left the ministry as a result and walked across the street to Columbia to study child psychology. In 1928, he received his PhD and went to work in a child guidance center where he worked for 12 years and wrote and saw patients. And it was during his work here that he started to really think about theory and working with people in therapy. He had some experiences there that basically suggested to him that his approach, and remember I said that basically counseling in the 30s and 40s especially was psychoanalysis or from a psychoanalytic perspective. And the next few theorists that we talk about, you're going to hear that they were trained as psychoanalysts, but then moved in another direction. And Carl Rogers had some experiences where he moved away from his training and started to really think about a different way of working with people. He did work as an academic in several positions, in training and teaching positions and therapy positions at Ohio State and the University of Chicago and Wisconsin-Madison. He wrote several books during the 40s and 50s and 60s, basically delineating and revising his ideas on counseling theory. He was very interested, and he was really an important person in making the field of counseling think about research and what is it that works. And he was very interested in that and did a lot of work in that area of actually testing interventions to find out what is it that we do in counseling that works, what is it that does not work, and testing his own theoretical ideas. While he was in Madison, he worked, and there is in Madison, there is an institution for people who have, a lot of the people there have schizophrenia or personality disorders, significant personality disorders and other chronic mental illnesses. He hypothesized that his approach, his person-centered training, would be effective with the patients who were at Mendota. Mendota is a institute. It is now, I think it was then, a forensic institute where people went when they were found not guilty by reason of insanity. So it's basically a prison-like setting for a lot of the people there. But he did research because he believed that his approach would be effective even for people who had schizophrenia and other mental illnesses, psychoses, and so on. And did find that people who experienced his form of therapy, that the high degree of empathy and the positive relationship, did have better outcomes. So found some support for his theory there. In the 60s and 70s, he was really involved in that research process and outcome research and what happens in counseling. And in the 70s and 80s, he spent a lot of time taking his approach to the international level, and he was involved in working with international conflicts in South Africa, Ireland, Russia, Eastern Europe, and really taking it global. He was the president of the American Psychological Association for a period in the early 70s, and just basically a person who kept busy, really promoted his theory, really believed in his ideas. He died in 1987 after what he described as a full and exciting 85 years. So that's Carl Rogers, the person. Let's talk about Carl Rogers' theory. I want to focus on, this is one of the, I think one of the less complicated theories of personality, theories of counseling. Two really main ideas involved in this one, the idea of self-actualization and the critically important nature of the relationship. So we're going to talk about those two things. Carl Rogers' view of the person. Carl Rogers and person-centered therapists see people as trustworthy, good, resourceful, self-directing, growth-oriented, so moving in a direction that is good for them, capable of effective decision-making, and positive change. So this is another humanistic perspective. Humanism emphasizes the essential worth of the person and attributes capability to people to grow, develop, and solve their own problems. Rogers identified an actualizing tendency, and this is an inherent and natural tendency. So inherent, it is within us all, naturally within all humans, this tendency of an organism to develop all its capacities in ways that serve to maintain or enhance the organism. And brief story from his farm background. He talked about one time going into the cellar on the farm there, going down, and he noticed that there was basically a crack of light in the cellar door, and there were some potatoes being stored down there in the cellar. And he noticed that, when you leave potatoes alone for a while, they tend to start sprouting and growing. And he noticed that the potato leaves were all growing toward this little crack of light. And it's the same idea, basically, that people like potatoes. We naturally, it is inherent in us to grow toward the light, to do those things that are going to maintain us or enhance us. So self-actualization can be defined as our striving to realize our potential, to become what we are capable of becoming, to be the self that we truly are, to grow to be our real selves, or to obtain the maximum for themselves. So that's what we mean by self-actualization. In terms of the view of the person continuing, self-concept in this perspective is conscious and subjective, so not subconscious. We're talking about a person is the sum of their thoughts and feelings and values and relationships, all stuff that we have access to, we can think about, and basically who we think we are. So none of this subconscious things below the surface. We are who we think we are. We are the sum of our thoughts, feelings, values, and relationships. And we see this concept again of phenomenological perspective. The reality is the world as you know it, and our experience is subjective. Okay, same idea we talked about before. And what's important here is that the counselor needs to be able to enter the world of the client, understand the meaning of the world to the client. So the question then is, if people are naturally and inherently designed to grow towards things that are good for them and to do things that are good for them, why do we end up getting into trouble? And we'll talk about this concept of the organismic valuing process. Right? And what this means, the organismic valuing process, this is a natural and instructive process of taking things in. We take them in, we experience them, we judge them on the basis of whether they are good for us or not. Behavior produces good feelings if it furthers the actualizing tendency. And you can really understand this if you think about babies. If you've ever been around many babies, you notice that they tend to explore the world orally. They crawl around and put things in their mouth. They taste things. And if you give a baby a bowl of fruit or baby food and it tastes good, then they intuitively and naturally trust that this is something that is good for them. If they put something in their mouth that they found crawling around that tastes bad, if they find a bottle of something or a piece of something that is dangerous to them, it will taste bad, and they will understand that they should stay away from that in the future. So behavior that is rewarding, that is good for us, self-actualizing, produces good feelings, and we tend to repeat that. So babies have this intuitive and natural sense of what is good for them by experiencing the world and trusting themselves. Early in development, we have a need for love and positive regard. A need. So when love is provided unconditionally, we have access to this need for love, and we have access to positive regard. We have the freedom to explore and develop in good, instinctual, and self-enhancing ways. So when the environment is nurturing, the organism will reach its full potential. But that's not always the case, as we know. Love is not always given unconditionally. And so when we are faced with the need to have love, but we learn that love is conditional on our behaving a certain way, then even if that behavior is not natural to us, not instinctual, we will behave that way because we need love and positive regard. So when love or attention are given conditionally, we live according to the will of others. We live according to introjected, and we've heard that term before. Remember, the superego is the values of our parents put into us, put into that superego. Similarly here, the ideas and values of other are put into us, and they become the conditions of worth. If we meet these conditions, then we are worthwhile. And this is how, to answer that earlier question, this is how people get into trouble. Because we don't always receive love and positive attention unconditionally. We learn to get what we need by doing things that are not good for us, and that not being true to ourselves causes us to get into trouble. It also causes conflict. We know what is good, and we know what we're doing, and they're not the same. We have conflict, we have anxiety. The individual accepts the values of others to gain love and to feel self-worth. Those values become part of our personality, and if behavior, even instinctual behavior, goes against these values, the result is going to be a loss of self-esteem, anxiety, and basically we are torn between what we know we should do or feel we should do naturally and what others expect of us. So we experience anxiety, rigidity in self-concept, and a lack of openness to awareness. We start to be people who are not our true selves. So the other key concept, I said there was two, this idea of self-actualization, and then the other one that is really critical in this theory is the relationship. Roger said that people have vast potential for understanding themselves. We have potential for solving our own problems on our own. We don't need the therapist to do that. We don't need people to tell us how to go about solving our problems. But we do need people who will offer us a relationship in which we can understand ourselves and we feel like we can make decisions and take risks and solve our problems. So people who are capable of self-directed growth if they are involved in a specific kind of relationship. Here we're talking about a specific kind of therapeutic or counseling relationship. The attitudes and personal characteristics of the counselor or therapist and the quality of the relationship are the prime determinants of outcome. All right, what we're saying here is theory and techniques are less important than the fact that you have certain attitudes about the person and that you and the person you're working with have a relationship that has some specific characteristics that we'll talk about in a minute. So this is important. It's a theory that doesn't focus too much on techniques, but it's more about establishing a relationship. So what are the characteristics of this relationship? There are three that we're going to focus on. Three counselor attributes should be present in the relationship so that a person can move forward and become what they are capable of becoming. And we describe these conditions as necessary and sufficient. The attributes are not only necessary, but sufficient. And that's a term you may see again. Necessary and sufficient means they have to be there. It's necessary that these three conditions are there, and sufficient means if they are there, if these three conditions are met, then that's all you need for positive growth. So what are the three conditions? They are congruence, accurate empathic understanding, empathy, and unconditional positive regard. Congruence is genuineness, realness. Your thoughts are one with your behavior. I'm going to talk about these a little bit more specifically. Accurate empathic understanding is accurately seen from the perspective of the client, actually seeing the world through the eyes of the client. And then positive regard is unconditional caring and acceptance. So what would congruence look like? What does this mean in the counseling relationship? Carl Rogers described it as almost being transparent. What you are doing, what you are saying, and your behaviors are one with how you are feeling. There is no hiding. There is no agenda. There are no things going on beneath the surface. What you are seeing is what I am, and I'm being genuine and real. And as I feel things and think things, and I'm going to say things and do things, and I'm just going with the flow, and what you see is what you get. So that's what congruence would look like. Accurate empathy, empathic understanding. What is empathy? How can we get accurate empathic understanding with the client? Empathy is essentially feeling with another person. It's different from sympathy, which is feeling sorry for somebody, but not necessarily putting yourself in their shoes. Empathy is actually putting yourself in the person's shoes, being able to feel what they're feeling and experience what they're experiencing. And my second question, how do we develop this empathic understanding? And what I think we need to do in order to understand a person is, as a counselor, gather information. We need to talk to them. We need to listen to what they say. We need to listen to their experiences. We need to ask questions when we are not sure if we understand what they're saying. But in order to really see the world through the client's eyes, we need to spend time talking and gathering information so that we can understand exactly how they are seeing things and experiencing the world. And then the third one is giving unconditional caring and acceptance, unconditional positive regard. And the positive regard part may not be too challenging, but the unconditional positive regard, a lot of times I think that may be. We meet people who we may not feel a strong liking for. So what do we do there? Basically, Carl Rogers has said it's important that we work to establish a relationship of caring and acceptance that is unconditional. And the way I think we do this too is we talk to the person, we get to know them, and if we have empathy and if we can really understand their experiences and their view of the world, then it becomes more likely that we will be able to value them and accept them unconditionally. So, three conditions. If they are present, then you provide a situation in which the person you're working with can, as is natural for them, or as becomes natural for them again, they can solve their own problems. So the focus is not merely on problems, but on the person. And the idea here is we don't go in with the goal of helping them to fix this problem. We go in with the goal of helping them through this relationship to become more themselves, more fully functioning, more integrated, and more independent. And if we can achieve this, then we're not just helping them to solve this problem that they came to see us about, but we're helping them to cope with future problems and avoid future problems. So it's really a more fundamental sort of change that we're talking about than helping a person to solve a specific current problem. The basic goal, again, this idea of there's a universal goal and then there are individual goals. The basic goal here in this theory is our goal is to encourage people to become increasingly actualized, to have openness to experience, to trust themselves, to develop an internal rather than external source of evaluation, to evaluate themselves in terms of their own values, and then to develop a willingness to grow and take chances. Carl Rogers said, "If I can provide a certain type of relationship, the other person will discover within him or herself the capacity to use that relationship for growth and change, and as a result of just being in this relationship, personal development will occur." So therapy is relationship is therapy. Relationship is really the key in person-centered theory. Positive and constructive personality change occurs when two people are in psychological contact. The client is in a state of incongruence and anxiety because they have been experiencing the world according to values that are not their own. The counselor is congruous, integrated in the relationship. The counselor has unconditional positive regard for the client. The counselor develops accurate empathic understanding and communicates it to the client. And then the client will experience this empathy and unconditional positive regard and use this relationship to work toward self-actualization. That is a brief overview of person-centered theory. The main ideas, again, I'm trusting that you will have read the chapter and a little more in-depth understanding of Carl Rogers' ideas, but that's sort of an overview of the big picture and the key ideas. I wanted to talk for a second about what this means and how this is used in rehabilitation counseling and what the research says. Is the relationship really so important? And where people have identified limitations in terms of using this theory in rehabilitation counseling is that we do tend to work in situations where we are very goal-oriented, where we do have a specific goal in mind or a specific problem that we are going to address. And person-centered theory isn't really so much about working on a specific goal. It is about, as I said, developing a relationship that will allow the person to achieve their goal. So is the relationship really more important? What does the research say? And this was a fairly recent study in the rehab counseling literature where they looked at the level of facilitative conditions and how interpersonal skill of the counselor related to various rehab counseling outcomes. So a large sample of people, and they looked at some of these relationship issues, and they were interested in seeing whether relationship and interpersonal skill were related to positive rehab outcomes. What they found is that higher levels of facilitative conditions and interpersonal skill were related to higher vocational gain at closure of voc rehab services, higher monthly earnings at follow-up. That's interesting. People who felt like they were in a relationship with a counselor who had the necessary and sufficient conditions were making more money when their case was closed, and at follow-up they experienced more psychological change, and those who reported higher levels reported greater job satisfaction. So the implication there is that this relationship does seem to be related to better and more positive rehabilitation outcomes. Another idea is a closely related issue called the working alliance, which is a way of describing, a specific kind of relationship between a counselor and a client, and similar idea, a little bit different in how working alliance is defined. It tends to be talked about in terms of things like level of trust and feeling like you're working, cooperating together for a common goal. So slightly different idea, but similar in a lot of ways too. And what some recent research has found in terms of the working alliance relationship is that it accounts for most of the variance in positive outcomes. So when they ask people, was counseling successful, did counseling work, and they look at all the possible variables that could go into that, techniques and all the variables of the client, all the variables of the counselor, it turns out that of all the things that could make counseling work, the thing that is most important is indeed the counseling relationship. 70% of the variance. So significant, and suggests that Carl Rogers was certainly onto something in emphasizing the relationship. Other ideas that where this theory has been talked about and researched in rehabilitation counseling research, it's been suggested that working with people who are recently disabled or recently diagnosed and working through the adaptation process, it's been suggested that the person-centered counseling approach may be very effective and most effective early in the process of working with people. Rehabilitation process and person-centered counseling questions, is it more appropriate for some clients? And it has been suggested by some authors that it is more appropriate for clients who can develop insight and have a certain kind of relationship. But as we talked about, what Carl Rogers said is basically it works for everybody, even the most the people with the most significant mental illnesses, cognitive disabilities, and so on. I think it's safe to say that Carl Rogers really believed that this therapeutic approach would be effective with anybody. Do we need techniques, interventions, and goals? That's a question that I'll let you think about. As I said, it's a theory that doesn't emphasize techniques and goals, and sometimes in rehab counseling we do, or we feel like we are required to focus on short-term goals and specific interventions. Certainly I think rehab counseling and person-centered theory can work together, and frequently do work together, as we saw with good success in a lot of cases. And then finally, there have been some issues raised about the idea of culture, and this perspective is a individualistic perspective to a great extent. It emphasizes the individual very definitely, and the idea is that there are some cultures that take a more communal approach to problem solving, either family-based or community-based, and that this approach may not work or work well with people who do take a more integrated community-based approach or family-based approach to problem solving. And that's something to keep in mind. It is a verbal approach. In other words, it relies on conversation between two people, a lot of verbal interaction, and introspection and insight based on thinking about yourself. So again, ideas that are perhaps somewhat culture bound, and again, that's something that you can be aware of and think about. May not be accepted as well by some people. So I think that, let me just check. Yeah, that concludes our overview of person-centered theory, and I'm going to conclude this one with some terms we've learned and talked about and that you should understand now and be familiar with this semester. So far we've talked about determinism, humanism, phenomenological perspectives, and those are those theories that emphasize seeing the world through the eyes of the client. And then today we talked about self-actualization, key idea in person-centered theory.